if you go back to 1950, we had one oral drug to treat diabetes, sulfonylurea. Over the last couple of years, maybe 5 to 7 years, we've got probably 7 or 8 first-in-class drugs. Recently, the SGLT2. Prior to that was the GLP-1. Prior to that was the DPP-4. We have Cyclocet now. So we really have a lot of options for physicians to prescribe. So where have you been as far as you're comfortable with prescribing SGLT2s and DPP-4s and SGL1s? Are you comfortable with those drugs? Most family practitioners will want to wait 5 to 10 years before prescribing a new medication, fear of side effects, complications. So what are your feelings when it comes to using those new drugs with patients?
So the general principle I follow is that you have to set a goal for each patient, together with the patient, to decide where the level of blood sugar really should be. And as we've been learning, it's not always the same. Many studies have shown that extremely tight control in older patients with heart disease may not be beneficial. So first thing, you set the goal. Then you try to achieve it with lifestyle measures as much as possible and with as few medications, in my view, as possible. That's not always the view of every endocrinologist, and I respect their opinion. Some think that combination therapy from the beginning may be a good approach. I happen to think that as you add medications, you are increasing the risk of side effects. So if you can achieve your goal with one medicine, it's probably better than with 2 or 3. But I wouldn't argue, with success, whichever way it is achieved. I still think that metformin for type 2 patients is the first line medication. It's been around for 60 years or so. There's a lot of information. We know what it does, what the risks are, what the benefits are. And then very often, if the goal is not achieved with metformin alone, if the side effects were not significant, then one wouldn't stop metformin. The literature will suggest that you add another medication to it, a second line. It could be DPP-4 inhibitor these days, because combination of metformin and DPP-4 does not produce hypoglycemia. And essentially any other class you can add to it. The newest class, as you said, that's been approved is SGLT2 inhibitors. There's a lot of information about them. I have limited experience with these medications, but from what I know, they're safe, effective. They can help with weight loss. So I started using them. I don't necessarily wait 5 years or 10 years, but the new medications I would use carefully and follow patient a little more often than with medicines that I know a lot about.